Hi family, hi friends, hi fans, good afternoon, good morning, good evening, whatever time you're watching this channel. This is Regina the nurse, and today I have another health talk on my channel. Today I'm going to take you through danger signs in a child. This is mostly between the age of months to 5 years, when children are oftenly get sick and they have these on and off sicknesses and on and off visits to the hospital, so that you can know when your child is sick what you need to do and what you need to take action for your child. So to start with, the age of months to 5 years, we call it a very sensitive age for a child, and this is when most of the children get sick. And common sicknesses in children at this age, they usually have what we call the fever. You find that a child just develops body temperature all of a sudden, and you don't know what to do. Fever can be caused because this child maybe has an infection in the system that has been there, but now it has come out of incubation period, and then you find your child is just spiking fevers to a temperature of 38, 40, anything that is not normal. So when a child develops this, it's always good to have maybe you can start by giving your child maybe we call it Calpo or Panadol syrup before you take the child to the hospital, because fever is very, very dangerous, and when it's very high, a child can develop convulsions and other complications. So fever is very, very dangerous for a child, and as soon as you know your child has a fever, please, it's good to go to the hospital so that you can do further investigation to establish the cause of this fever. Another danger sign in a child of that age is diarrhea, and diarrhea is passing of loose stools more than 2-3 times in a day, or unusually the way the child always passes stool. And diarrhea can always progress to become dangerous, because whenever the child is passing this loose stool, they tend to lose a lot of water in their system, a lot of ions, so they develop this imbalanced system in their body, and it can be worse and get to worse, because dehydration is very, very dangerous in a child. And because passing of this stool can also be investigated, it's good always to go to the hospital so that your child is checked upon by the pediatrician to establish what could be the cause of the diarrhea. And when a child loses a lot of water, they become quite sick, they become lethargic, they become so fragile, and they seem to go down every time they're losing water. So whenever you see diarrhea in your child, please go to the hospital as soon as possible, see the doctor and get checked up. And another sign or another danger sign in a child is vomiting. Sometimes diarrhea and vomiting can come together, and vomiting also involves losing a lot of water and ions in the system. And so when a child just develops this unusual vomiting more than one time, maybe they're not even they have not eaten, they just tend to vomit, projectile or even frequent vomiting, it's not good at all. It's good to go to the hospital and get established what is the problem in your child by visiting the pediatrician or the doctor, and then your child will be checked upon. Sometimes the diarrhea and vomiting will lead to admission, and then your child can be rehydrated by getting fluids. And this is very, very important, because when they are vomiting and they are diarrheaing, they are not able to take fluids orally, or they are not able to feed. So they need to be compensated on the loss by getting a parenteral feed or a parenteral fluid, so that the wasted ions and fluid is replaced, so that your child can come up again. So also, a child who is not feeding well, maybe your child is a good feeder, is been eating well, and then all of a sudden they don't have this appetite, they have lost their appetite, they are losing weight. This is also not good for your child, because when you're not eating, actually your body system seems to go down, you lose weight, and all that can lead to other diseases. So even if your child looks healthy but not eating normally, it is always good to go and establish what is the problem, why is not my child eating, and get some boosters or get some supplements for your child, so that they can pick up again on eating well and continue with good and healthy life. Another danger in a child is having a chest congestion. This is where you feel that your child has abnormal breathing. When they are breathing, you feel like they're having some difficulties in doing this. Actually, you can see they're having a labored breathing or taking a lot of energy to breathe out and in. And so this is also not good, because there could be some infection in the chest. There could be some problem in their chest. They need to go to be checked up by the doctor, by the pediatrician, so that you can get treated. And mostly when you have a chest congestion, it's an infection, and this infection will lead to fever. This fever will lead to the child not eating well, and not eating well can lead to loss of weight and all that I've discussed about. So having a chest congestion, once again, is not good in your child. Please seek help as soon as possible, so that your child is healthy and happy like any other child. We have children between between months and 5 years as common, those who have common visits to the hospital because of these diseases or these conditions that I've talked about, or these danger signs that I've talked about, and they should be addressed as soon as possible, so that your child does not get to complicate, can avoid admissions, because as soon as you address this problem, it is countered and it cannot lead to your admission to the hospital. And if your child is also to be admitted, don't worry, it's nothing bad. Just accept the admission so that your child is treated by getting the intravenous medication, because when a child is vomiting and diarrheaing and is so weak to feed, they cannot then swallow oral medication. So they are preferred to have the intravenous medication for them to get well as soon as possible. So I was taking you through this just to give you health talk on how your child should be monitored at home before you go to the pediatrician. And I think it is good to take care of our children so that they're healthy and happy and they're growing as they should grow. Another thing to note, by the way, is also how your child is adding weight from birth up to, so when a child, sometimes when they're born, during the first 1 year, they tend to add weight very well, gradually to around 15 kgs, and at some point they tend not to add kgs so well, they add only grams. It's nothing to worry about, because the body, when the child is growing, they start having activities, and that is when you find they are having to lose weight, because when your child is starting now to play about, walk about, then they will not be able to be conserving that energy to be adding, so they tend to stagnate at some point. So what I'm saying in short is that weight gain or weight monitoring is very important. So it is good to take your child to the clinic up to that age of 5, so that they are given all the necessary immunization, necessary vitamin A's, necessary supplements, and this growth of your child will always figure out in that graph, going up and not going down. So family, that's all I had for today. Thank you for watching my YouTube channel. If you're new here, this is Regina, your nurse. Please consider subscribing, consider liking my videos, sharing, and always commenting for me to improve where I have to improve. So guys, thank you. Keep on watching, tuning for more health talk that I'm loading up every time.